Okay, so in other news, it was Anzac Day last weekend, and for those of you who weren't at the pub, maybe you saw this interesting story on ABC News about treating PTSD in veterans.
The Royal Commission into Veterans' Suicides is being urged to investigate the use of sedatives to treat soldiers with post-traumatic stress disorder.
Tasmanian Senator Jackie Lambie says alternative treatments must be considered and made available.
There's other therapies out there without putting these veterans straight on benzos and mixing them with every other drug that they try and put through their system.
There's beginning to be a worldwide conversation about the potential use of psychedelics instead of opioids for the treatment of depression and other mental illnesses. Recently, the US state of Oregon legalized the regulated use of magic mushrooms in a therapeutic setting. And in the UK, Bristol has recently opened up its first high street provider of psychedelic-assisted psychotherapy. Even podcaster Joe Rogan seems excited by the idea of the use of psychedelics in kickboxing.
People are using psilocybin these days in what they call microdosing, taking very small doses and seeing these profound benefits. Yeah. And one of the things that I'm aware of is kickboxers are using it.
Funny how Rogan recently came out as anti-COVID vaccine for young, healthy people, but is all like, yeah, give the kickboxers mushrooms. Also recently, the Global Drug Survey revealed that more and more Australians are turning to psychedelics to self-treat mental illness and emotional distress. Now, I don't want you to do that. If you're suffering mental illness or in emotional distress, please reach out to your GP for a mental health plan or call Lifeline. But I did get a chance to chat to the head of the Australian arm of the Global Drug Survey, Dr Monica Barratt from RMIT, about what all this means for the future of psychedelics-assisted psychotherapy in Australia. Joining me now is Dr Monica Barratt, who is a senior research fellow at RMIT's Social and Global Studies Centre and was the lead of the Australian arm of the 2020 Global Drug Survey, which I believe found some interesting developments to do with Australians turning to psychedelics to treat mental health. Is that correct, Dr Barratt?
Thanks for having me on the program. So the Global Drug Survey last year, just before COVID hit actually, collected some data from over 100,000 people globally. Around 10% were from Australia. And, every year we ask about all kinds of drugs, but this time we asked more about psychedelics than we usually ask. So we actually delved into whether or not people were not just taking them recreationally, but also considering their use for self-treatment. So did they use them to feel better because they have mental health issues or psychiatric problems or relationship problems, this sort of thing. So, we had over 6,000 respondents say that was what they were using psychedelics for. We asked them which psychedelics they used, and they were the sort of most common ones: LSD, psilocybin, which is the active ingredient in magic mushrooms, and MDMA, or commonly known as ecstasy. These were the most common, but there are a whole heap of other ones that folks described using: DMT, ayahuasca, these sorts of psychedelic drugs. And then mainly for the sorts of conditions that you think that are most common anyway when you consider what mental health conditions are out there. So this is depression, anxiety, relationship issues, and less common, but certainly, important to consider were issues of trauma. So people with post-traumatic stress disorder and other kinds of issues around trauma mentioned that they were using psychedelics as self-treatment.
And why the focus on psychedelics this year, or was this just part of the overall study?
Well, overall, it's quite clear when you're watching this literature, as I've been for quite some time, that the last decade, we would say that there's been a renaissance in psychedelic research worldwide, especially the use of psychedelics as medicines as opposed to simply as psychoactive drugs that people maybe take to change their perceptions or to feel a certain way. People are also looking at these as medicines. So we have a number of clinical trials, randomized controlled trials around the world, either that have been conducted, reported on, or are still underway, looking at the efficacy and the safety of some of these substances, which for many decades have been considered to not have medicinal purposes. That's essentially what we do when we prohibit drugs and say that they, are only ever possibly used recreationally or as drugs of dependence. We're basically also saying that they're not medicines, because there are many drugs out there that are all of those things and also medicines. And these get scheduled in a different way so that they can be produced, I guess, as an example, morphine, and many of the opioid drugs are produced at a pharmaceutical level and provided to people in hospitals for pain or prescribed for pain. And they have a lot of controls on their use, because it's understood that they can be used or misused. But when it comes to drugs like LSD and MDMA, these are not drugs that have traditionally been considered also medicines. But this last decade has really changed that, with some of the studies coming out showing efficacy in treating conditions that have otherwise been incredibly difficult to treat. So people with treatment-resistant post-traumatic stress disorder, where for decades they've been trying to manage debilitating condition that it's really makes it very hard for them to live a normal life. And for some of these people, psychedelic assisted psychotherapy is a game changer. So I think that's why, one of the reasons why we wanted to look at this issue again in our survey, and especially because at this time, most people wouldn't have access to these substances as typical medicines. Maybe if they were in a research trial, they might, but that's always, a very small percentage of people. So we're not at a point anywhere in the world where someone can go to their doctor or their psychiatrist and easily access these substances. We're starting to talk about that now in many parts of the world and starting to move further towards that. And my sense is in the next sort of 5 to 10 years, it's going to change. We're going to have more results come out of the medical trials that are underway. It's possible that there'll still be, grave concerns, and these are powerful substances, so we do have to treat them that way.
It's fascinating stuff. The Guardian recently had a very interesting article about the opening, I think, of the first UK high street clinic offering psychedelic assisted therapy. And it was fascinating read saying that it could, its treatment for alcohol dependency and depression that is resistant to other forms of treatment. The findings could be very interesting. And then I read, I think that the Greens and the ACT here are
they
interested.
want to move this forward. Yes.
Yeah. Is there any? Will we possibly be heading in the same direction as the UK with this? Do you think? Is that kind of the aim?
Look, I think eventually we will move in that direction. I say that knowing that there needs to be a number of things in place for that to happen. So over the last 6 months, there's been an attempt to change the scheduling of both psilocybin and MDMA through the Australian Therapeutic Goods Administration. So there was a private applicant to downschedule them just by one level from Schedules 9 to Schedule 8. And this is so it's a small change. But
and what does that mean exactly? That means you will be able to use it for research, is it? Or?
Yeah, so not quite. So it allows greater access by medical professionals, but they still have to go through a strong set of processes. So it certainly wouldn't result in that high street type arrangement that you mentioned there. But a reduction from Schedule 9 to Schedule 8 would mean that, say, more psychiatrists could apply on an individual basis to be able to supply these drugs. The thing is, though, of course, there then has to be a supplier. And because psilocybin and MDMA are not drugs that pharmaceutical companies can make much money out of, hardly any at all, for two reasons. They're out of patent, first reason, but secondly, the way that they work, they essentially, when we look at the trials of these drugs used in a medical setting, they work basically 2 or 3 doses over sort of 10 therapy sessions. So most of those sessions are are just talk sessions, counselling sessions without the psychedelic, but 2 to 3 of them will also have the psychedelic as well. And then the sessions before and after will be preparation, integration, this kind of thing. So it involves a lot of people time, which has to be paid for, but it doesn't involve a lot of drug. I mean, that's 2 or 3 doses and that's it. That's it. Like, you don't have to take it every day for the rest of your life. Like the most drugs that psychiatrists prescribe are like that. They're daily, forever. So this is very different, and it is obviously not the same level of profitability that would attract a company to invest, because there isn't a pipeline of people that they're going to be on forever. And indeed, it might even be the opposite, because they might come off their antidepressants, they might come off their antipsychotics or other drugs they might be on. So you don't have the same financial drivers. So with the Therapeutic Goods Administration here, they have put out their interim finding, but they haven't put out their final finding yet. The interim finding basically said no, we don't think we're ready. They took the advice of some of the more conservative submissions from, medical people, psychiatrists, etc. in Australia, who said, look, we're just not ready. We need to find out more from clinical trials locally that are not yet complete. So at the moment, we are still awaiting the final ruling from the TGA, but it's almost inevitable that it will be no, not yet. But that doesn't mean that this will stop.
Is it just, why do you suppose there's a lack of wanting to look into this further in Australia? Is it just these drugs have a bad reputation from we think of the hippies in the 60s and the 70s and that kind of thing? Like, if these drugs were discovered today, would they be a lot more serious about researching them, do you think?
It's possible. I guess when you look at the Therapeutic Goods Administration's interim ruling, you see that there are a number of statements that they make that are quite, I would say, like they came out of 20 years ago. Right. That do show, I guess, a stigma or a sense of staying with the old ways of thinking about these substances. Having said that, they do state that they are willing to review the situation when local trials are completed. And so I see this really as Australian officials wanting to see Australian data and assess it that way. And what that also says is that we need to make it easier for research trials to happen. It's a very tricky task at the moment. I'm not heading up any of these trials, but I'm a close colleague with someone who is. And he has told me the red tape, I mean, you can just imagine, every single step of the way in terms of the chain of custody of accessing medical grade MDMA for a trial is very, tricky. It just takes a long time. I think, though, once this trial is set up, and it only wants to have 4 people, the trial just wants to show that it can be done in Australia, that we can set up all of the right chains of custody for the substances and have the right training and do all the things in the right way. And then, of course, they'll be interested in seeing the findings from those 4 people. But then I think after that, once they've shown, yes, it's feasible, then it will be let's enrol many more people and do a proper trial in Australia of the sorts of things that we have seen really positive results of overseas. So I think replicating those trials here will change the minds of the TGA. Of course, if the results don't come out, then it's not going to change their minds. But the results seem quite remarkable on all the trials. They do. They seem, you look at these trials and you say, well, this is treatment-resistant, long-term, debilitating trauma. And, 3 months, this treatment is full on. It's, 10 sessions with 2 to 3 overnight stays at a hospital that involve psychedelics. This is a lot of time and energy. But, they follow them up 3 months, 6 months, 12 months down the line, and people are changed forever in a really positive way. So my fingers are crossed that will happen here too, and that sort of treatment will be possible for the, people in the community that I know that have suffered trauma and still can't move through it. and they can't get on with their lives. And it's really sad, because almost always when people suffer trauma, it is not their fault. I mean, I would say 100% of the time it is not their fault. And yet there they are, burdened with trauma and its repercussions. And so, it almost seems, and I think this has been the argument from some people, is to say, well, we need to cut through all this red tape. We need to get these drugs out to these people now. People are dying, they're committing suicide. So some people have really come on very strong there, and they've said, we need to get this sorted out. But of course, if we do make it too accessible, and if we don't have the right training in place, and we don't have the right systems in place, then we might end up too far the other way with, shonksters handing out MDMA and, things going wrong. So it's just getting that balance right so that things don't go wrong on either side of the pendulum.
Yes. And clearly, based on the research, we shouldn't be encouraging everyone to just go out and microdose, because these things, they're not for everyone. They can be dangerous. So everyone, I think I'll just be microdosing with a glass of wine after work, if that's okay.
Look, I mean, it is a bit ironic, really, because, alcohol is responsible for a very large proportion of the harms from psychoactive substances in Australia. Yet, of course, many more of us drink it. So, but yes, it's a whole other topic to consider, microdosing. With these self-treatment approaches, they are very much more the macro dose or the standard dose, rather than a microdose, which, by definition, microdosing shouldn't be something that you perceive a psychoactive effect from. It should be so small that there's something changing. And I mean, microdoses will say, yes, I can feel a difference in the way that I respond to stress or whatever, but they're not experiencing, by the definition of a microdose, it shouldn't be a high enough dose for them to actually experience, say, altered perception or, hearing sounds differently or all that kind of stuff that you might associate with some of these substances.
Fascinating. Before we go, anything else you want to add, or anything else?
We'll just say that if you're interested in Global Drug Survey, either doing the survey or looking at all our reports, you can go to globaldrugsurvey.com and you'll find lots of things there that might be interesting to you, including some of our free harm reduction apps, which are pretty good too.
Fantastic. Fascinating stuff. Thanks for making time to be on Newsfighters, Dr. Monica Barratt.
Thank you.
Thank you.
Newsfighters, Australia's funniest news summary podcast.